March marks Colorectal Cancer Awareness Month, which is why we're here at Karmanos Cancer Institute. And joining me right now is Dr. Charbel from MSU Healthcare. How's it going?
Hi, and thank you so much for having me with you today.
Yes, we're excited to have you here because these are important conversations that need to be had. We're talking a little bit about colorectal cancer. So what are the first signs when it comes to this kind of cancer?
Well, this is where it can get tricky because oftentimes with colorectal cancer, you don't have presenting signs until it's a later stage, which is why it's so important to get your screening colonoscopy. You want to detect things early before they become symptomatic. But if it does get to the point where it's symptomatic, you might see something like change in your bowel habits, blood in your stool, abdominal pain are the most frequent signs that we see with that.
Now, are there any treatments when it comes to these kinds of cancers?
So treatment is typically based on what we call a multidisciplinary tumor board meeting, which is a great symposium where you will have oncologists, radiation oncologists, pathologists, surgeons, clinical trial coordinators. Everyone is in attendance, and these meetings happen twice a month. So if you are diagnosed with colon or rectal cancer, typically your case will be presented at these meetings, which is great because we have input from all different avenues of care, and they will ultimately all work together to tailor make a plan for you. So it's not just a cookie cutter program for everybody. It's very specific to you, the stage of the cancer, your overall health, and what your goals are, it's a fabulous team. I can't say enough good things about it. And that's where your treatment would really start, with that meeting, and then we go from there based on those recommendations and the consensus that comes from that panel. And it also depends on what stage the cancer is found. So again, if it's an early stage, we have a higher success rate with that and a long-term prognosis for survival. So really getting the colonoscopy is the best thing you can do for yourself to make sure you have a better outcome.
Definitely. And so what about the risk? So obviously screening is the big thing that we're trying to push here, is getting those screenings in, but are certain people more at risk for this cancer?
Yes, absolutely. So if you have a genetic predisposition, meaning a family member perhaps who's had colon cancer, or a genetic mutation within the family that you've perhaps inherited, that would put you at a higher risk factor. And that's something you would talk with your doctor about to find out if you have that, based on your family history and personal history. So those people are at the highest risk. Okay. Average risk is typically 1 in 25 people.
Oh, wow.
So it's still pretty high.
Oh, absolutely. So definitely want to get those screenings in. Walk us through a little bit about that process to make sure that we can get that on our calendar.
Right. So typically you would start with your primary care provider, and if you're 45 years of age or older, then you're certainly a candidate. And if you're having any issues like rectal bleeding, change in bowel habits, and you're younger than 45, you still may need a colonoscopy, which would be a diagnostic colonoscopy at that point. So start by talking with your primary provider, who can then send a referral to a gastroenterologist or colorectal surgeon, or even general surgeon as well. All of these folks do colonoscopies. So the main thing is just to get in there and get screened.
That's right. Well, you heard it here. Do that. And of course, we have all that information on how to get that conversation going and how to get those screenings scheduled, all on your screen. But thank you so much for taking some time out of your busy day.
Oh, my pleasure. Thanks for having me.
Yes, to get these important conversations in. So thank you.